Hello, my name is Kumah-Crystal. I'm a pediatric endocrinologist and biomedical informaticist. Today, I'm going to be talking about communicating with the electronic health record by thinking aloud. I would like to disclose that our research team has a research relationship with Nuance Communications. We use their natural language processing libraries for research and development. So, I'm sure many of you have found yourselves in this situation before. You finally have your appointment with your doctor, but instead of having a conversation with you, all your doctor can do is stare at the computer screen. This must be very frustrating for you. Well, here's something you might not know. Your doctor is equally frustrated too. They would like to be talking about your medical problems and having conversations about your goals, but they're trying hard to find the information they need to take care of you buried inside the computer. Think of it like this. Your computer health record contains a lot of information, like your medical notes, your labs, your prescriptions, any x-rays you might have had. So for your doctor, finding any one piece of information on the computer health record can sometimes be like finding Waldo on a busy desktop computer screen. So we wondered, what if we could make it easier for your doctor to get the information they needed to take care of you? What if we had a way for doctors to get right to this information without having to type and click and hunt around for it on their computers? Well, mainstream technologies like Siri and Alexa can tell you the weather, set reminders for you, and even play your favorite song, simply by asking for it with your voice. So, why couldn't we do that in medicine? Well, maybe we could. This is Viva. Viva is a voice assistant like Siri or Alexa for doctors. It can help your doctor find the important information they need to know about your health.
Hello, Viva.
Hello, Jessica. I hope you are well. I look forward to helping you today.
What can you do?
Here's how I can help. Currently, I can give a brief summary of the patient and report their vital signs and some labs. I can also report a patient's medication list and place orders for health maintenance. I will be gaining more skills along the way. Try asking something like, "Tell me about this patient," or "What is her weight?"
Tell me about this patient.
Charlotte is a 17-year-old female, noted to have diabetes since 3 years ago, last seen by you 1 week ago for ketoacidosis. Shall I continue?
Yes.
She is scheduled to be seen with you on March 12, 2020. Her latest A1C was 5.2%, measured 1 year ago. The family's preferred language is Spanish. They require an interpreter. You last documented a progress note for her 1 week ago. She was seen in the ED recently.
What problems does she have?
Charlotte's problem list includes anorexia nervosa, type 1 diabetes, hypothyroidism, and seasonal allergies.
What health maintenance does she need?
It looks like Charlotte is due for some diabetes screening labs including celiac. Everything else appears up to date. You can order them right here. Would you like to order them?
Yes.
I have added your order for celiac that you can sign in the encounter.
Speak faster.
Okay, I'll speak faster.
What is her weight?
Charlotte's latest weight was 47.0 kilograms, measured 1 week ago. Shall I continue?
Yes.
Compared to her previous measurement of 49.0 kilograms from about 8 months prior, that's a decrease of about 2.0 kilograms.
Speak normally.
Sure, I'll speak at a normal speed and volume.
What is her A1C?
Charlotte's latest A1C was 5.2%, measured 1 year ago. That corresponds to a blood sugar of 103. Shall I continue?
No.
Okay,
Thank you, Viva.
no problem, Jessica. I hope I can help again sometime.
Goodbye, Viva.
See you later, alligator.
So, how does this work? Well, Viva takes a user's words, turns the sounds it hears from speech into text. Then it uses natural language processing to understand those words. Then it says, aha, it looks like you're searching for a lab called an A1C. Let me go get that for you. This is called intent fulfillment. Viva then displays the results on the screen, and she also summarizes the information she knows aloud. For those of you old enough to remember, it's kind of like that game, Mad Lib. Viva is able to find the important information in a patient's medical record, then overlays those findings on a template, which allows it to speak back the relevant information out loud for the doctor. By leveraging voice, we can help your doctor literally communicate with your medical record by thinking aloud, so they can better understand your care. In addition to Viva, there are other great industry leaders that are thinking through how to help doctors find relevant information just by using their voice. For example, doctors can use voice commands to search the up-to-date database for information about diagnoses and medications, and have the information appear right there on their screen for them to review. Hey Dragon, search up-to-date for appendicitis. Hey Dragon, search up-to-date for hyperthyroidism. And there are other voice interactions with the medical record available even today. EHRs like Epic, who we've partnered with, are thinking through how to scale this new interaction modality to doctors across the nation. Show me her creatinine results.
Here are the latest results.
Imagine how your medical experience could be different. If we could take away the computer as the wall between you and your doctor and actually make our machines become participants in our conversation to help you and your doctor understand your medical story better. And that's just the first step. There's a lot of great work being done by our partners at Nuance to capture real-time conversations between doctors and patients and have an AI generate a summary that you can both benefit from. And this is without your doctor having to break away from you to go type up their note. And one of the most important aspects of all this work is teaching computers how to understand human speech. Humans do not speak like text in a formal letter, as we all know. Text can be fragmented, disorganized, there can be repetition, hesitation, corrections midway, sometimes all in the same thought. And then there's the idea of context. So, if a patient says to a doctor, I ran out, that could either mean I ran out of the house and twisted my ankle, or I didn't take my medication because I ran out. A child as young as 5 would be able to use the context of a conversation to understand what the person was saying. But these are the kinds of things we need to teach our computers to be able to do. Helping computers understand the nuances of human communication will be key to making these conversations work. And then what about your own ability as a patient to find information from your medical record? Would it be helpful to ask a voice assistant about your next appointment or your labs or for a medication refill? Well, good news. That's actually coming down the pike as well, eventually. We're working with our industry partners to think through the best ways to bring these interactions to you. Because really, what would you expect to hear back if you asked a voice assistant about your health? How much information is too much? What's quite enough? How exactly should it be stated? Here's a fun consideration. So, did you know that Alexa can convey emotion in her response? Yeah. Here's an example of a happy Alexa emotion.
I'm playing a single hand in what looks like a losing game.
Here's an example of a sad Alexa emotion.
I'm playing a single hand in what looks like a losing game.
Now, is this something we should try to leverage when communicating your health information to you with a voice assistant? Like, hey, your lab results are ready when things look good, or hey, your lab results are ready when things don't look so great? As funny as that sounds, these are really the kinds of things we have to be thoughtful about to make sure the user experience makes sense. It's an interesting time that we're living in where our computers can now understand our words and help us find the information we need just by thinking aloud. By being very thoughtful about how we approach these problems, we can create meaningful experiences for you and your doctors and make your health information accessible on a whole new level. I'll end here with a quote by one of my favorite authors. Imagination is the beginning of creation. You imagine what you desire, you will what you imagine, and at last, you create what you will. So, if there are any questions about using voice to communicate with a medical record, feel free to reach out to me. Because I imagine we can get really far together just by thinking aloud.